So, hi, I'm Dr. Shilpa. I'm a practicing gynecologist and fertility specialist at Bangalore. So, today's topic for discussion is symptoms of fibroid. So, fibroid is a very common tumor which is seen in the uterus of woman, and we should know that 50% of the fibroids don't present with any symptoms. So, majority of the patients, like 50% of them, come to us with a scanning report, that is the ultrasound report, saying there is a fibroid, and that scanning was not done for any gynecological complaints. It was done for something else, say like a routine in a master health check, or for gastritis, or for like say kidney stones, or for gallbladder stones. So fibroid is incidentally diagnosed during that time, and that is when the patient comes to a gynecologist. This happens in 50% of cases of fibroids. So if the woman is symptomatic, then what are the symptoms that the woman will have? So fibroid commonly presents in the age group of, say, like in a reproductive age group between the age of 20 and 50, and majority of them are say they are very slow growing, and they don't grow very fast, and the chances of cancer is very less in them. And the symptoms that the woman will come with is, one is heavy menstrual bleeding. That is, if they are bleeding, say like for around 2 or 3 pads in a day, then suddenly they notice that the bleeding is increased to 2 more pads extra per day, and or the bleeding may be prolonged. If they were bleeding for 5 days during periods, they are now bleeding for 8 days, 9 days, and the bleeding doesn't stop. So heavy menstrual bleeding is one of the classic of fibroid uterus. There could be associated pain when they have their periods, and because of heavy periods, their hemoglobin could be down, where we see that the patient come with anemia, and we have seen on extreme cases where the hemoglobin could be as less as 4 grams, 5 grams, when they have had very heavy bleeding in that cycle. So sometimes what happens, when they touch their abdomen, they feel that there is something hard in the lower abdomen, and once we do the scan, we see that there is almost like a very big fibroid which is there on the uterus. So feeling the mass per abdomen is one of the symptoms of fibroid, where they feel that their trousers or their the lowers are getting tighter, and they're feeling that their tummy is coming a little forward, and they think it could be fat. The other thing that is commonly associated with fibroid is the fertility issue. So this happens when the fibroid is very close to the uterus, and this prevents the implantation. And if the fibroid is very close to the cornu, that is the opening of the fallopian tube, then it can press on the fallopian tube and cause blockage of the fallopian tubes. So apart from these, the symptoms depend very much on the size of the fibroid, the location of the fibroid, the number of fibroids. If there are multiple, I have seen in a single patient who has around 40 fibroids which we have removed. And also it depends on the age of the patient and our desire to retain the uterus, desire for fertility. All these things matters when it comes to the treatment choice too. So coming to the other rare symptoms, like the fibroid can get impacted and it can cause urinary retention when it just goes and gets stuck near the urethra, and sometimes it can cause problems in the kidney, where the fibroid is so big that it is pressing on the ureter. And also it can cause problems in having sexual intercourse if the fibroid is in the vagina, protruding from the uterine cavity. So this also can give rise to intermenstrual bleeding, where the bleeding can happen in between the periods also, and this can lead to problems, say like if it is a fibroid polyp, there could be painful spottings and bleedings throughout the cycle, where the quality of life for the woman is compromised. So these are the symptoms of fibroids. We should brainstorm in detail about the various aspects of fibroids, which I will be doing in the next coming sessions. Thank you so much.